Thank you all for joining us today. We're going to begin in just a minute. While we're letting folks in, please feel free to type your name and your jurisdiction and your role in the chat so we get to know each other, and type questions in the chat at any point. We will get to them towards the end, but I know for me, for one, if I don't spit out my question when I think of it, it vanishes. So anytime in the chat, and you will be receiving a link to these slides and to the recording, likely tomorrow, but at the latest, the early next week. So you'll be getting them soon. All right, well, it looks like we have a critical mass and we have so much good content to share with you today. And so pleased that we have 3 jurisdictions with us today, including one that has already been approved to implement kin-specific licensing, Michigan, whom you're going to hear from soon. So we're just very excited to share all this great information with you today. I'm just going to share a little bit about the network for those of you who may be new to us. But we are the Grandfamilies Kinship Support Network. We're the first federally funded technical assistance center on the families. We are run through the Administration for Community Living, so the aging and disability arm of the U.S. Department of Health and Human Services. We are here to support kinship service providers in government agencies and at nonprofits. So if you have a need, please reach out to us, including with anything to do with the content that we're talking today. Because fortunately, Marina Nitze is one of our subject matter experts, as is Heidi Redlich Epstein at the American Bar Association and Stephen Olander at Think of Us. So we have an array of talent to respond to your assistance needs. We host webinars like this one on a regular basis. We're launching a number of learning collaboratives. We respond to, like I said, individual requests for assistance. So specifically around this rule and kin-specific licensing, but also around the array of issues. How many affordable housing projects are there for grandparents raising grandchildren around the country? Who waives child support assignment for kinship caregivers in order to access TANF? All those kinds of questions we're here ready to answer and respond to you free of charge. And we have lots of written resources and videos and our webinars that are recorded on our website, which is linked right there. And it looks like this. So that's our landing page. And in the top right is the request assistance button, which will take you to a form to request any of that assistance that I mentioned. Just want to share a couple of resources before I turn this over to Marina, which is a toolkit that she pulled together for us with her working group of many jurisdictions. And it has just really great practical tips for how to find kin. This is directed at the child welfare agencies. So how to find kin who have been removed from their homes by the agency so that the children first placement can be with a kin or a relative. And it has a lot of tips and a lot of resources from jurisdictions around the country. And then this is a very simple 2-pager that may help with your stakeholders who aren't in the weeds of child welfare agency final rules and kin-specific licensing. And it also links to the standards that Marina's going to talk about today. So I encourage you to look at that and share that. And then please follow us on LinkedIn. We will sign you up for our newsletter if you're not already signed up automatically from attending this webinar. But if you tell us you don't want to, we won't. But we hope you will subscribe to our monthly newsletter. It just comes once a month, so we won't inundate your inbox. And with that, it is my pleasure to turn it over to Marina Nitze. As I said, one of our subject matter experts here at the Grandfamilies Kinship Support Network. Also one of the, I would say the primary author of the kin-specific licensing standards, but she's saying co-author because she's humble and gracious and awesome. So I will turn it to you, Marina.
Thank you so much, Anna. So welcome, everybody. I'm really excited to give some updates today about the kin-specific licensing, but I want to start out with a quick overview in case anybody is not as familiar with it. And if Ro, you could jump 2 slides to overview of the rule. So there was a federal rule. We considered it kind of our Valentine's Day gift last February 14th. That was a draft rule that proposed that for the first time, agencies could have a kin-specific licensing or approval process that addressed the specific needs of kin. Ro, can you bump 2 slides forward, please? Thanks. And with this, the rule was open for public comment. And for anybody that is perhaps not familiar with the public comment period, you never know how it's going to go necessarily, but this one went amazingly. There were 162 comments. They were basically all positive, and they were all consistent. And the value of consistency when you have a federal rule is that when they're reviewing all the comments, they want to find, what are people disagreeing about, or where are there points that we have to make edits? And because there were so many consistent and positive comments, the rule finalized, I think, faster than any rule I've ever known. And so on September 28th, there was a final rule that said that Title IV agencies, states, tribes, and territories can indeed have kin-specific licensing. The rule made it optional. But I just wanted to highlight what an amazing positive response was, including many, many, many people I see in the participants list here wrote in comments from their states and tribes and organizations, which was really, really impactful in terms of getting it approved and approved quickly. Next slide. So the federal rule itself does not have a lot of requirements in it for what a agency has to do for kin-specific licensing, or for non-kin specific licensing for that matter. So the federal rule, and this is a common point of misconception, so I think it's really important to touch on for a minute. It requires that the kin caregiver and meets the federal requirements for background checks, for criminal background checks. And it requires that your licensing or your approval standards are, quote, reasonably in accordance, end quote, with the recommended standards of national organizations. And Anna and Heidi and others I see on this call were co-authored the original model standards for foster homes, and now have come back to co-author these new standards for kin-specific licensing and approval that recognize the unique needs of families. Next slide. So more specifically, for each kinship caregiver that you want to approve, you have to do a fingerprint-based background check, and you have to check the child abuse and neglect registry, including that of any state where that caregiver lived in the last 5 years. And then for each adult living in the kinship caregiver's home, you have to check the child abuse registry, including that of any state where they lived in the last 5 years. So this is the federal requirement, so it's not too overwhelming. Next slide, please. There are some federally disqualifying crimes. And I think it's also important to know what this list is. And also, these crimes, if it appears on the background check of a kinship caregiver, are disqualifying for purposes of receiving Title IV reimbursement for the payments made to those caregivers. So many states, California even has a law, SB 354, do allow case-by-case exceptions where when everybody reviews the situation and the facts that happened and the caregiver and the child, it really is determined that it's in that child's best interest to live with that caregiver, even if they happen to have one of these crimes. And while the agency cannot get Title IV reimbursement for the foster care maintenance payments to that caregiver, those agencies that do this today pay them out of state funds, so the caregiver doesn't notice the difference. So we do think that's an important highlight. That's not a very common situation, but it happens. Next slide, please. And so the other requirement, which is mainly what we are going to talk about today, is that when you are choosing and designing your kin-specific licensing or approval process, it has to be reasonably in accord with the model standards of national organizations. So that's what we want to talk about, is the model standards. Next slide, Ro. And then one more slide to the co-authors. So the new kin-specific model standards were written by all the folks that wrote the original model standards, plus a number of additional partners. This is the only set of model standards in existence today. So basically, the federal rule says you have to be in accordance with recommended standards of national organizations. And just to clarify, this is the only set of national recommendations that exist. And so we pulled in the whole crew to co-author these. And next slide, please. And I want to highlight what is in them to make sure everybody is familiar. So the kin-specific model standards include the required background checks that we talked about that are federally required, plus a sex offender registry check, which you might think was part of the federal requirements, but isn't. But everybody does that, and we think it's a great practice, so we included it. It includes a caregiver assessment, similar to what you already do at an emergency placement, in terms of, what resources does this caregiver need? What is this caregiver willing to take in this child? Or is there perhaps a medical concern that maybe needs a safety plan or some sort of mitigation in order to make this placement work? And then a safety and needs assessment of the home itself, that is age appropriate to the child or their developmental level, to make sure that the home is safe. The goal of the model standards explicitly was that kin caregivers are licensed or approved all the time on the same day that they get placement. Now that might sound a little bit bold depending on where your state is in terms of how fast you can do fingerprinting, or obviously if that caregiver lived in another state in the last 5 years, there's going to be some delay getting the child abuse and neglect registry checks back. But we really set this as the goal because every kinship caregiver should be supported financially and otherwise the same way as every non-kin caregiver is, from the first day of placement. And so this is our goal, and this is very much what it was designed around. So the model standards largely model what agencies do today for their emergency placements. Naomi, I see you asking about the caregiver suitability assessment. I'm going to talk about that shortly. A couple of other things the model standards include having a really expansive definition of kin in terms of who qualifies for a kin-specific placement and the kin-specific licensing. Effectively, if you qualify for a kin emergency placement, you should then qualify for kin-specific licensing or approval in your agency. We have a recommended definition that we worked with a lot of states and tribes to recommend. Some agencies have effectively the same definition, but some slightly different words, and some agencies are doing the work now to expand their definition. The model standards include a number of example policies and forms for all of this, because we really heard when we were designing them. And let me explain a bit about how we designed them too. We worked with 45 states and tribes and hundreds of kinship caregivers to understand what are your processes today, what's your emergency placement process today, what's your licensing process today, where are people getting stuck, where are people getting confused, and took all of that information over the course of at this point, a year now, to develop the model standards. We tried to address also a lot of very specific questions that people had, where they were like, hey, 5 years for a disqualifying federal crime, when does that 5 years start? Or if dad's parental rights have been terminated, can his mom still count as a relative? We got a lot of really great questions from so many of you, and we explicitly answered them in the model standards. Or if we didn't feel like we had an answer, then we sought guidance from the Children's Bureau or other places to make sure that you got or are in the process of getting an answer. So we tried to be very, very specific and then include model forms for all of it. So we have a safety and needs assessment form that we designed, that we tested with lots of kinship caregivers in diverse environments, who lived in perhaps mobile homes, who lived in apartment buildings, who lived on Native American reservations, to make sure that there weren't questions or qualifications that didn't make sense in their environment, and we found ways through it. And now I'm not saying that they're perfect, because that's why we have agencies that are starting to use them now. And if we catch errors or opportunities for improvement, we're going to keep making them better. Next slide, please. I just want to show a map of all of our co-designing, which I think is pretty cool. We had almost the entire country involved in some way. So we hope that the model standards are representative of many of your current practices. I would say that our experience so far working with agencies has been that the adopting kin-specific standards is relatively close to most agencies' placement processes, emergency placement processes with kin, with a few changes. So Ro, if you could bump to the next slide, I just wanted to give like a quick overview of what the forms were. So we have the kinship caregiver safety and needs assessment. We have a recommended criminal history evaluation form for your use internally when you're evaluating caregivers' history if they happen to have one. we actually added a form, which I will admit is not a thing that I expected to do, but we added a plain language consent form because kinship caregivers told us over and over that in that moment, they're getting a placement, they weren't necessarily expecting it. They're facing a very confusing process. They wanted some plain language understanding of what they were signing up for and what to expect. And so we actually added a plain language recommended consent form that kinship caregivers can read and kind of understand what's ahead of them. We provide an application form that kind of covers all the basis of the information that you would need from the kinship caregivers and potentially other adults in the home. We have a recommended out-of-state child abuse and neglect findings request form. This is a part that we heard everybody is really struggling with in terms of points of confusion. So we wanted to offer something there. And then we are about to publish the last missing piece, which is the so-called kinship caregiver suitability form. But I will say that the concept of a caregiver being suitable, that term really has not resonated well with people. They reported it sounded judgy and uncomfortable. And so we are reframing that to kinship assessment. And we're going to have more about that a little bit later today as we talk. And then, Ro, if you want to jump to the next slide, we also want to make sure you're aware of this tool, the crosswalk tool. It's modeled off of something, for those of you in the weeds of your Title 40 plans, called Attachment X that you probably have already for your current law licensing process. And basically, the crosswalk tool has each of the requirements on the left. It's a downloadable spreadsheet. It's not particularly long, don't worry. And then you can go through it and say, this aligns, this doesn't align yet, but we're planning on it. Or in some cases, in your particular situation, you might say, hey, this actual model standard doesn't work for our agency. Maybe it requires a legislative change or something else. And remember, you have to be reasonably in accord with the standards. And there's no exact definition of how many you have to follow or not, I guess. Most folks are generally following them. But if there's one or two pieces, you have the ability to work with your Children's Bureau regional manager to figure out your exceptions there. So the crosswalk tool, a lot of people have reported to us, helps make the standards document kind of easier to digest. And it's a quick way you can run through and say like, oh, we actually already do a bunch of this stuff. We just, have to do this, this, and this. So Ro, if you want to jump to the next slide, which I really want to celebrate. So many of you, I see so many people here, our panelists have been working hard on implementing kin-specific licensing or approval to some extent. Some of you have legislative needs so it means that you'll be a year or two away. Others of you are moving, but we want to celebrate very loudly that we have 2 approved agencies that have been given a green light by the Children's Bureau to go forward with kin-specific licensing and approval. That would be Michigan on this map of our states. And this map otherwise shows just general interest in the country of interested in implementing agencies. And then, Ro, if you can bump one more forward, the Salt River Pima Maricopa Indian community also was approved. And I want to give them a shout out that they were first. So thank you so much to them and their hard work for setting the bar for the country. So we are excited to celebrate both of those. And I imagine there will be a whole swath. I know that there's a bunch of you who have submitted your plans and who are waiting. It's not a race. Nobody should feel that way. But I also just really want to celebrate the sense of momentum and forward movement on this. It's pretty crazy for a federal rule to launch September 28th. It took effect November 1st. And here we are in March, and we already have 2 approved agencies that have gone live. So that's just really incredible. And I hope folks are really, really proud of that. Great. Next slide, please. So I just want to talk a little bit about some promising practices that come up, and then we're going to do a panel discussion with some of the agencies that are in the weeds of implementing, plus Jessica from Michigan, who's over the implementing hump, I guess I would say. So a few promising practices to talk about that people have particularly asked about. The first set, Ro, is about fingerprinting. And so again, when I mentioned could you be approving or licensing 100% of your kinship caregivers from day one of placement? If anybody gives me a funny look, it's usually like, well, wait a minute, we can never get our fingerprint results back that quickly, or we can't collect fingerprints that quickly. And so we're going to continue to collect and disseminate information about fingerprinting promising practices throughout the year. There are agencies that can collect, receive back, and evaluate fingerprints on the same day. There are multiple agencies that can do that today. So there is precedent. and we are excited to help more. And as Anna said, you can send us a note if you need any TA help for this. And we're happy also to connect you to the agencies that are doing some of these things. So you can borrow their practices, borrow their guides, things like that. So for fingerprinting, a few promising practices that are really working well. One is making community-based options available. So kinship caregivers have told us again and again that going to a police station to get fingerprinting is a very scary experience. It causes delays. And also, we've shadowed caregivers going to police stations to get fingerprinted. And because police stations do so many other things, very often they actually tell people, like, wait a minute, you can't get that done here. You must be confused. And then the caregiver gets sent away, and it just causes, even more confusion in a very traumatizing time. So many places have community-based options available. There are statewide contracts to get you UPS stores, FedEx stores, different sorts of community-based places that are well lit, have night and weekend hours, have parking. A few agencies have actual contracts that require evening and weekend hours for these fingerprinting locations every 30 or 35 miles. I'm not sure that those are the perfect number of miles, but those are the ones that are there. And that sounds like a reasonable starting point to me, to help make sure that they're accessible quickly. Also, there are many agencies that have gotten in the weeds of their kind of fingerprinting details and learned that they're actually having to fingerprint kinship caregivers more than once in the process, because of the way that you've set up your fingerprinting codes, either with your state police or with the Department of Justice. And I won't get too much in the weeds here, but if this is a problem you're having, please head up the network for TA and we can help explain. You can use something called fingerprint purpose code X, which means you are going to fingerprint that kinship caregiver one time, and you don't have to do it again for adoption or do it again for guardianship or do it again later on in the case, which is something that a number of agencies reported thinking that they had to do. Mobile fingerprinting units, hugely helpful. They're a bit expensive, and so we appreciate that not everybody can have them everywhere, but especially in areas where you may have remote or geographic challenges, islands, or a very, very large state. These have been reported as extremely helpful because the worker who has to go to the home anyway can bring the mobile fingerprinting unit with them and take the fingerprints right then. In-office fingerprinting units, also, some agencies have practices where the kinship caregiver is always coming into the department office. And if that happens to be the case, having having regular fingerprinting units there can also help make the process a lot faster. And if you are part of a tribe, there is a pretty amazing program from all the feedback we've heard called the Tribal Access Program that can help tribes collect and get back fingerprinting results directly. In places that don't have access to the Tribal Access Program, we have definitely heard that tribes are experiencing some of the largest delays because they have to go through the most number of hops in the process. They have to get it, wait for their child welfare agency, who might have to wait for their health and human services agency, who might have to wait for their state police, and so on. And so we really encourage you, as you are looking at your fingerprinting process and at kin-specific licensing and approval, make sure that you're working with your tribes to make sure that they have just as speedy, if not maybe hours slower, process that you have in your state. I see some questions about undocumented kinship families. So we have some great practices that we put in the model standards document from agencies that currently license or approve kinship caregivers who did not have immigration documentation. There are a few places that you want to be particularly careful with these families. One is having an alternative to fingerprinting. So in the agencies that do this, they run a name-based background check and do additional kind of steps within their state to run the background check, but they don't run the fingerprints. In that case, it means that they are not eligible for Title 40 reimbursement for the foster care maintenance payments, but they have made a conscious choice that they will use state funds to help offset those kinship caregivers. It can also be a point of complication at payment, but some states have, and other agencies have come up with some creative workarounds with prepaid debit cards, or checks or other arrangements that they can make with those families. So we have started to collect promising practices in that area. They are in the model standards document. There's a section about it. But by all means, if you continue to have questions or challenges, or if you have a practice that you think is working well, we will continue working on this to help support those families. Next slide on evaluating background checks. So in terms of evaluating, some agencies have a belief that basically nobody is allowed to view the results of a background check. Now, this is, of course, up to your own agency and your policy, but it is not like a federal law. So I do want to be clear that you have probably a lot more flexibility here than you realize. There are definitely steps that need to be taken. People need to have themselves fingerprint-based background checks to be able to access. And of course, it's certainly not appropriate for just anybody to review the results. It has to be somebody that's working directly on that case. But if your agency has 1 or 2 people who can review results, we definitely want to encourage looking at perhaps expanding that. A couple of agencies have a practice of having a daily decision meeting where all the people who can make the decision, so the supervisor, the area administrator, whoever you need, meet collectively. So if there is a kinship caregiver with background checks that require a review, they can do that quickly and come up with either a safety plan or decide on a way forward for that family. Obviously, every kinship caregiver, just by default of being a kinship caregiver, doesn't necessarily mean they should be approved. We're not trying to say that. They may have a very concerning criminal background check or other concerns that mean that a placement is not appropriate at that time. At the same time, thinking about how you're structuring your meeting, how you're structuring your paperwork, and how you can think about getting to yes, rather than thinking about how you are going to deny that family. That mindset can help think of some creative ways to help families be supported and thrive given their unique circumstances. Again, we have a model standard form, and the form in the model standards here is actually based on the recommendations in the original model standards for evaluating criminal background check history. So it shouldn't be particularly surprising to most agencies. It may be actually quite consistent with what you do now. But we took, it's sort of a Frankenstein's monster. We took a bunch of agency forms that were working well, and we took the best parts of all of them and then made them into one new super form. And then also there's a model standard form if you do have to deny a kinship caregiver that uses plain language that we have tested with real people to say, hey, we can't approve the placement at this time. Here's what to do next. And also here's appeal instructions, because sometimes an appeal is the appropriate next step. Okay, so let's jump into our panel discussion, which I'm very excited about. So our panelists, maybe I should have you guys introduce yourselves. How about that? How about Jessica? Do you want to introduce yourself?
Sure. Hello, everyone. My name is Jessica Sweet. I work for the Michigan Department of Health and Human Services in the Children's Services Agency, and I am responsible for the unit that oversees caregiver recruitment, support, and training for our state, which includes all of our kinship efforts in the state of Michigan.
Awesome. Lindsay?
Hey there, good afternoon. I'm Lindsay Coleman. I'm the Executive Director of Child Programs at the Department of Children's Services in Tennessee. And my responsibilities include overseeing programs related to foster care, adoption, interstate compact, and independent living. So great to be here.
Thanks for being here. And Amber?
I'm Amber Hassler, and I work with the Oklahoma Department of Human Services, and that is our public child welfare agency here in Oklahoma. I'm the program administrator for our ICPC program.
Great. Thank you guys all so much for being here today. So my first question, I'll start with you, Jessica, is what impact do you expect this to have on your licensed kinship rate? And when you answer that, maybe you could explain a little bit about how Michigan has been licensing kinship caregivers up till now.
Sure. I actually want to start with clarifying that the new standards that have been publicized very much in Michigan, because we're very excited about it, do only apply to those kinship providers who are in our formal child welfare system, because there's been a little bit of confusion about that. So I did want to start with clarifying that. And then as far as our formal child welfare population, since April of 2019, Michigan has been providing our unlicensed relative caregivers with the same level of financial support as our licensed providers. We also made licensure optional during that time because we recognize that kinship providers without that financial incentive to become licensed likely were not going to want to pursue that. And we didn't want to make the placement contingent on them pursuing that licensing process. So as of February this year, to no surprise, we were only at about 11% of our relatives receiving licensure. As of March 4th, with the new kinship licensing standards approved in Michigan, we have implemented our new process. We're calling it approval here in Michigan. And we are requiring all of our relative providers with a placement on or after March 4th to go through that approval process. So we have the capacity to jump from 11% to 100% of our kinship providers becoming licensed. We did decide when we were implementing the new standards to not require our legacy caregivers, that's what we're calling them, our caregivers who had placement before March 4th, to go through the approval process if they didn't want to. However, we are incentivizing them to complete the fingerprint requirement, which is the only additional requirement we added to our current placement process for our kinship licensing or approval standards. We are incentivizing that $300 per family to go ahead and get those fingerprints completed so we can get some of our legacy caregivers approved. And we are also partnering with Casey Family Programs to offer, we're kind of calling them fingerprint fairs, but that's probably not what we'll actually call them because that doesn't sound very fun. But we will be hosting these family fun day or fingerprint fairs in targeted areas of the state where we have a lot of kinship providers that are legacy caregivers, where we will have a family fun day at something fun and exciting for the whole family that we'll pay for with the sponsorship of Casey Family Programs, in exchange for getting fingerprints completed. And then those caregivers will also be eligible for that $300 incentive payment. So we're hoping that that will really increase the number of legacy caregivers that will also pursue approval at this point, since there isn't really a financial benefit outside of the incentive payment that we're offering for them to do so, since we've already been paying them this whole time.
That makes tons of sense. And I see a question, and feel free, we can talk about this later if you'd rather, but I think you're in a same boat as a few states that up till now have been paying kinship caregivers. So to your point, like the licensure rate wasn't necessarily that high. If after the fingerprint something comes up, do you have a plan for what to do? Or I'm guessing you're not really expecting that given the amount of involvement you've had with these families.
Yeah, so we currently make placements, but run background checks and everything ahead of our placements. We just weren't doing the fingerprinting piece of it. So we're not anticipating that a lot of criminal history will show up that didn't already show up on the background checks that we were doing previously. However, if something does show up, there is a fingerprint assessment we're requiring the case managers to do when we get those fingerprint results back. So if there is one of those 4E prohibited offenses, we can assess that at the time. Does the placement make sense to continue or not based on the new findings, which is what we would do anytime we discovered new information about a placement as the placement was going on.
Thank you for explaining that. And Lindsay, how about you? What impact do you expect this to have on your licensed kinship rate in Tennessee, or maybe on your workforce?
Yeah, our rate isn't necessarily going to change because we've been paying kinship families as well. The difference is they'll be able to receive our full rate faster because we had a reduced rate until they can become approved through our traditional foster parent approval process. And now because they can get approved in just a few days, they'll be able to receive that full payment sooner. So there's a difference in the payment, but it has made a significant difference in our workload and our workforce commitment. Instead of doing all of the things that we would do before to get a kinship family approved, the fact that we've lessened our forms from 17 forms to 6 and 3 home visits to 1, and just the training time frame, we had a contract for formal home studies to be written, which we were no longer having to use for kinship families, and it significantly reduced the work. And we were doing an expedited home study, like an emergency home study at the time of placement anyway. So really it wasn't all that much to add a few additional questions from the documents that you guys saw earlier in the presentation to do the full assessment right there. So I think it's definitely it's going to take some getting used to, I think, because it's a different set of staff who are doing that full assessment at the beginning, but they're excited about it. And I think, I mean, everybody's really excited about the opportunity to be able to get kinship families supported earlier on. So I think we definitely reduced the workload, and the costs associated as well. I mean, everybody, well, at least all of government, it seems like it's always good to associate a cost savings, I think, as well. So
Awesome. Thank you both so much for sharing that. So I want to talk about ICPC for a minute. So what impact do you expect this will have on ICPC, Amber?
Well, our hope is that it will solve the timeliness quandary that ICPC has historically had since its inception. And so having the ability to have a really streamlined relative process with other states will allow us here in Oklahoma to, of course, place our kids quicker in other states. And then, of course, as we implement, we'll allow that same courtesy for other states to have that more quick decision on their 100A so that we can place with kin a lot quicker. And so for Oklahoma, I'm thinking back a few years how we've, had ongoing conversations about border agreements. And I know I've talked to Tennessee because you guys have border agreements with everyone that touches you. And border agreements have been kind of an issue of contention around here with some of our bordering states because of our child welfare laws and how they just differ and how we serve families through the CPS investigation side. And so we're very excited about the possibilities of our neighboring states adopting and implementing kinship model standards so that we can eliminate the need for border agreements and see whole states respond in a more a quicker manner so that our kids that are going out of state can have the same opportunities to be placed up front with their kin and not have to wait on that ICPC licensure process because many states, have different sets of rules where they have relatives that are required to be licensed. I know in Michigan, we could get a relative approval, but then, like Jessica said, our families still had to go through the licensure process even after the relative approval was given. And so it alleviates a lot of those burdens for our families, but still allows us to financially support them because in the land of ICPC, relative approvals from Oklahoma used to mean no payments to those families taking care of those kids. And so now an ICPC relative approval in a state that operates under model kin will allow us as a sending state to provide financial support.
Thank you so much for that. We are definitely excited to follow along as we do some of these first, like maybe there'll be a Tennessee, Oklahoma ICPC and we can follow along and just make sure that
I think we sent one 2 days
no
ago,
last
so
hiccups.
I'm excited.
Oh my gosh. Okay. Well, please start that stopwatch, but that's really exciting. So thank you all so much for that. So Jessica, I'm wondering what impact you expect this will have on Title 40 guardianship in Michigan.
Sure. So we are really excited about the impact that this might have on our ability to access guardianship assistance payments for our kinship caregivers. With only 11% of our relatives being licensed, obviously that's a very small percentage that would be eligible for the GAP program. And those who would want to pursue guardianship assistance would have to go through the whole licensing process that our foster homes go through. And a lot of times we were seeing it was taking over 6 months, sometimes a year for our relatives to get through that cumbersome process. And then they have to do another 6 months on top of that to qualify for the guardianship assistance payment. So it was really delaying permanency. With the ability to start that clock within the first 30 to 45 days of placement, we really feel like by the time that we're evaluating for that permanency goal of guardianship assistance, we should already have those 6 months in place. So it shouldn't cause any further delays in guardianship being able to be pursued as an option for these families. We did find out throughout this process, though, that our state statute, unfortunately, requires licensure. So we are working with our legislature right now to change our state statute and allow for approval to be considered the same as licensure for our state statute as well. So that's in process. We're hoping that'll be done in the next 6 months. So by the time our first few families are eligible for GAP, the state statute will be changed. That's our goal right now.
Oh, that's awesome. And for the families that weren't eligible for, like, were they having to wait through adoption, which my understanding can be like an extra set of years, or what were their alternatives?
Yeah, so most families would end up going through the adoption process instead of the guardianship assistance process, which is unfortunate because adoption requires termination of parental rights, and that's not always what our kinship families want to do. So it really limited those options. I feel like for the adoption process or guardianship assistance, going through licensure probably would take about the same amount of time. So, I mean, really depending on what the goals were for the family, would kind of dictate what area they'd go in, but we know not a lot were pursuing guardianship just based on our very low percentage of families getting licensed.
Got it. Well, now I'm going to ask a question. So as the one of the first two agencies with an approved 4E plan, can you talk a little bit about what that process was like submitting your 4E plan update?
Sure. So I would say ultimately the submission of the plan was pretty easy. And this is because we moved forward with licensure in Michigan, we have licensure for our unrelated traditional foster homes and then approval for our relative caregivers. That's how we decided to differentiate. So licensure goes through our regulatory process, and that's all spelled out in our state statute. Approval was able to be outlined in our policy, so it required a policy update. Rather than going through the regulatory process and having to have state statutes updated, which did allow for us to submit pretty early. So we were fortunate in that respect. Because approval and licensure are so different in process and requirements, there was of course some back and forth with our ACF regional manager and regional analyst because they really wanted to fully understand what the differences were in Michigan between that licensure and approval. And I will say initially we did not submit the crosswalk that was shared by Marina. We had completed it, but we didn't submit it with our plan. Submitting it after they started asking a lot of questions really, I think, helped ACF understand the differences between the two approval and licensure in Michigan and understand exactly really what we were trying to lay out as approval in Michigan and why it met the standards. So I would recommend that everyone use the crosswalk. It was very helpful.
We didn't pay her to say that. No, I'm kidding. But that's good to hear that the crosswalk was useful for sure. So I'd love to go to each of you maybe and ask what's some of the feedback you've heard about the new kin-specific licensing or approval, maybe from families or from workers or from the public, anybody. And I'll start with you, Lindsay.
So I think from families, it's been really good. I mean, of course, they didn't know what it was going to be like if they didn't have it approved quickly. So, but I think it's been pretty seamless so far. From workers, I think that there was some apprehension initially when we started presenting it to our staff about not doing the required training, but having some conversations about how families raise children all the time without like a full foster parent training, and then also having an implementation of an optional individualized training plan if a kinship family wanted one. Kind of ease some of those concerns. Our legislature is super excited about it. They are very committed in Tennessee to trying to support relative caregivers, whether they're in foster care or outside of foster care. So that's been a really exciting thing for the legislature, and we're hearing a lot of really good feedback there. So I think the workers, sometimes I think we all take a little time getting used to change, but we've heard really good feedback in the implementation piece of it. And I think as we have a little bit more time under our belt, I think that those who did have some kind of concerns or speculations are definitely going to, be able to be eased on that a little bit, because it's just like regular families. So I think a big piece of it for us was about messaging and just making sure that people understood that this was new and that, we definitely had opportunities to track and adjust. And if we saw issues, we could get together. We've had a lot of meetings with staff Since implementation, just talking about like, hey, what have you seen and what's come up? And they've just identified like simple little things that we were able to talk through and kind of plan around. So I think overall, I would say that the response has been really good. Some apprehension from staff, but other than that, really, really good.
Awesome. Thank you for sharing that. Amber, what have you been hearing?
Well, we've been kind of doing a lot of talking. Leadership here in Oklahoma has been doing a lot of talking to field staff, supervisors about the upcoming changes because we're not quite to the implementing yet. We're working in the background to get things ready to go. And so right now, I think everyone is just still really excited about the change. Like, yes, we have some that have their mind made up already and are very hesitant and are more conservative type staff that are worried. And I know that some of our court partners are probably going to feel the same way when they see that things are going to look a lot different in the future for kinship families compared to our traditional families. Because here in Oklahoma now, our current process is that kinship families and traditional families meet the same requirements, go through the exact same process. And so walking things back takes a very special set of skills, and convincing people that this is the right thing to do for children and families. I think we've done a good job here in Oklahoma selling that because we're working to remove the administrative burdens on our staff of the checklists and the paperwork and the got to meet all of these requirements, and really putting them back in a position to do the meaningful work that needs to happen with these families and really being the actual resource worker to support the resource family. And, kinship care comes with its own special set of challenges, and not every kinship family needs the same thing. And so our staff know that. We in Oklahoma have the ability to grant waivers and exceptions pretty freely on a lot of things, so long as it's not background related. And it doesn't compromise safety. So we have flexibility in that way now already. It's just going to be a blessing to not have to go through all of the red tape to have to get there. So our staff are very excited about that. And the people that really have the vision for the future can see how that's going to benefit everyone all the way around. So we're really focusing on messaging and hoping that we don't lose interest and momentum before we can get our necessary administrative law changes made. So.
Well, we are cheering you on. Thanks for sharing that. And Jessica, what have you been hearing, especially now that you've gone live for a few weeks?
Sure. So I will say, I think mostly the feedback we've heard has been very positive. Michigan has been really leaning into kinship for quite some time now. So I don't think anyone was surprised by it. Our department leadership is very focused on trying to be a kin first system. Our legislature has supported that. So we're very fortunate in that way. I will say, since the messaging has gone out, the press release went out from the HHS secretary, and since then our local media outlets have been picking up the stories and have been not always providing the most factual information. So that has created a little bit of an issue on our end. We would love to be able to provide the same amount of financial support to caregivers caring for children outside the child welfare system. And I think there was a lot of hope that these news stories coming out meant that that was possible. And it obviously is not. We're not able to do that with these changes. So I think there's some disappointment on that end, just because there was some misunderstandings from the media as they were reporting the stories. So that's been, I would say, the disappointing feedback. So if we could go back and do it again, maybe making sure that that was really clear in the press releases, so that it wasn't misunderstood, because that's unfortunate. And it's something that population's been waiting for a long time. And I mean, fingers crossed, we will be able to get there, but unfortunately that's not right now. Overall, I think for our staff, I there was a little bit of a reluctance to the change of making people do the fingerprints now. And will that mean kinship caregivers will say no to placements because it's something that we haven't required previously? Since it's rolled out, we really have not actually seen that pushback from kinship caregivers. We're not seeing any decreases in the amount of kids we're placing with kin. So I think as time goes on and people get used to the new process and it becomes just the standard, some of that pushback will be, some of that fear that staff have had will be alleviated.
Yeah, and I think it's great. I mean, and I know you guys, because I meet with you all the time, like you've been tracking this data. And I think that another agency like, that's making a change, it's good to watch, hey, wait a minute, if our kinship placement rate suddenly, went down a bunch in a place, something's up and we got to go figure out what's happening there. And so I love that you guys are really tracking it. Great. So one more question. So, we've got Michigan, who has been approved, and Tennessee. I mean, you've gone live and hopefully your plan will be approved any minute now, which is very, very exciting. But not every agency is in that position because there's going to be some regulatory or legislative or other changes that are needed. So Amber, I was hoping you could talk for a minute about what does it look like to be in an agency that's really excited about this change, but you've got regulatory approval at play.
So yeah, a couple different things. In order to, yes, this is gonna require a few statutory changes down the road for us, but looking at what's the quickest way we can get something in play to benefit our kids and families, what we've really done is gone straight to our statutes and looked at how are we currently interpreting what this statute says, and what kind of leeway do we have to look at reinterpreting this in a different way so that we have some flexibilities with kinship families. And so by really kind of studying our statute and through consultation with, our legal division and attorneys and things like that, there's been very prominent pieces, for example, out of state specific criminal checks. The interpretation we've been working under required us to get state-specific checks in addition to fingerprint results. So we've now come to a conclusion that we're going to reinterpret that and we're going to use a fingerprint result. And then rather than having to tackle the statute change, because we found that we're not going to be able to get that in this legislative session, we're looking at our administrative code and adding in definitions for kinship resource assessment and defining that within our policy and ensuring that the things that our statute requires are still covered. So yes, our statute requires that our families have pre-service training, but our statute does not prescribe how that pre-service training must occur. So pre-service training for kinship needs to be defined. We're going to insert that in our definition, and we're going to clarify the general definition of pre-service training. We now have to put the clarifier of traditional pre-service training, kinship pre-service training, and we're going to make the decision on a leadership level within our child welfare division that this is what training can look like for kinship providers. And rather than it being a formal classroom type setting that we normally would send folks to, it's going to be something more hands-on. We're going to look at ways to give our kinship providers credit for lived experience. A grandma that has been a substitute parent for her grandchildren for their entire lives shouldn't have to go through 27 hours of formal classroom training. I think it would be okay to give her 6 hours of training for lived experience. And so defining that within our policy and our administrative code and focusing on that rewrite and getting it pushed through so that we have a timeline to say, we can expect our policy changes to go into effect here, ensuring it's not contradicting with our statute, That's going to allow us to move forward a little quicker in implementation without having to worry about statutory changes, since we know we can't get them this legislative session. So that's where we're at now. We're in the nuts and bolts of rewriting and retitling all of our policies and making new definitions based on more broad interpretations of our statute.
Thank you so much for sharing that detail. I think that's really helpful, because I've talked to a few agencies, they're feeling like, I'm a year out or plus. And I think that is just the reality in some places if you've got to make change, and that's okay. You're not in trouble with us or anything. But also I love the focus on creatively looking at what you can do now, how you could reduce training hours now, even if you can't, ultimately change kin training for a year or two. So I think that that's a super creative and inspiring approach. So that wraps up my panel questions. I want to thank the three of you so much for joining. And this was extremely awesomely insightful. And we'll have time for Q&A in a few minutes. And so might drag one of you back, or pop one of you back in for that. So thank you for joining us. Ro, if you could pop up the slides on what you can do now. We want to give a couple minutes about so you've heard all this. Hopefully you're really excited to implement if you haven't already been well in the process. And so a couple of things that you can do now. One is to review the model standards. And especially the crosswalk, Jessica said it, not me, that it was really helpful to go through. And you may be surprised as you're getting your implementation of, oh, we actually already do 30 of these 40 things. A lot of our work is going to be removing some of these steps, or, as we have to add fingerprinting at this step, or we have to add this one piece, but it'll help you get your arms around kind of the totality of the work. And then I love Amber's feedback around, like, you might look at the crosswalk and say, hey, actually, we can do a bunch of things now, today, for our kinship families, even in our current realm of licensing that is the same for everybody, while we're getting that regulatory change, while we're making legislative change, while we're making policy change. So really recommend jumping in. The document for the standards may look long, it's 70 pages, but remember that includes like model forms, model policies, lots of examples. And so we hope it's not too bad. And some things too, you might be able to adopt. Something that is relatively easier to change in many places are your forms. So like we talked about, I at least was surprised that we added a form. I expected we were mostly going to be removing forms, but when we added the consent form for kinship caregivers, that's something that you should be able to add to your system now for kinship caregivers, to help them navigate the process, to help them feel a little bit more comfortable about what they're signing up for and what they're being involved with. So looking at the model forms and saying like, oh, hey, we could actually change our safety needs assessment form now. Those might be steps that you can take towards implementation. And then next slide, please. So this is Marina's personal pet peeve / project for 2024. So many of you have already heard from me on this, or will be hearing from me. The big problem in kin-specific licensing is going to be the out-of-state child abuse and neglect registry checks, because we know that they take over 120 days to get back from some agencies. And I want to reduce that to days, like single-digit days. So we have interviewed everybody. We have looked at everybody's out-of-state child abuse and neglect registry checks. And we've identified some promising practices for how to fulfill them more quickly. Removing notaries or witnessed signatures. There are only a handful of agencies that require this step. That is a huge burden on licensing workers and on families, right? They have to get all the people together. They have to find a notary. It might be a Sunday. That has been reported as a huge barrier and burden. There is no legal requirement that these forms have to be notarized or signed by witnessed signatures. A couple of agencies have removed this in the last few months, so celebrating that. Removing fees. A handful of agencies also have fees. They're like $5, $10. That might not sound like a big deal, but the time it takes one state to issue another state a check can be months. And in our interviews, we found that usually social workers pay for these fees out of their own pockets, because they don't want to wait they don't want that kinship caregiver to have to wait months to get licensure or approval, or in a few cases, placement, until that they can get back. So if you have a fee, please remove it. And big shout out to Alaska for this last, I think 2 weeks ago. We brought it to their attention and no fee. So thank you guys. Also, using official emails as proof of identity. So many processes involve a worker like faxing in a copy of their ID or their driver's license. This might sound like a good identity verification step, but you actually don't know that their driver's license or their ID is real, and you don't have a way to verify it. So it's actually not a very good way to identify whether someone has an approved use case for requesting it. What is a really great use case is if they have an official email address, right? And so that sending the results via secure email back to a authorized, DCYF or HHS or whatever your email may be, that is a much easier, faster, and frankly, much better process for verifying that someone is, actually an agency employee. Accepting electronic requests, there are still about 10 agencies that only have mail-in forms. We get that is, it might feel like extremely daunting to have an electronic form and an electronic fulfillment process. If that's a thing that you need TA help with, please message us, because we have a few free and very secure options that a couple of vendors have offered that can help you keep track of your incoming requests and fulfill them electronically in a fairly simple way that will probably make your staff pretty happy too, to not have to deal with opening all that mail. The flip of that is you want to fulfill requests electronically too, via secure messaging or Dropbox, or many agencies have different ways of fulfilling them. And then the last piece here is accepting attestation of consent. We built this into the model standard forms. And what that means is there are a number of states now, Tennessee is one of them, where when you're requesting the child abuse and neglect registry check, you say, hey, this kinship caregiver gave me consent. I have it on file. And you don't have to have the kinship caregiver sign and submit a separate form. That's the part of the process that takes time. It's very confusing. And when the kinship caregiver is also navigating 7 other things, they've reported that it's extremely confusing to them. And so the agencies that accept attestation of consent, we think that that's a promising practice. Ro, if you could bump forward, we are lovingly tracking every agency's adoption of these promising practices or not. On the progress dashboard, I will drop a link in the chat. This is meant to be positive peer pressure. But again, I will be following up with anybody that's got a gray Trivial Pursuit square on here to say, hey, what help do you need to remove your fee, to remove your notary, to get an electronic option? Because I don't want this to be the thing that's keeping kinship caregivers from being approved or licensed. So thank you for listening to my out-of-state child abuse and neglect registry check mission. And with that, I think we'd love to open it up for Q&A. And Anna, I think you have some questions teed up. And if you want to answer them directly, that's cool. Or if you want to pitch them to me, whatever you'd like.
Thank you, Marina. Sorry for that delay. It always takes a while to unclick, it seems to. Yes, I have quite a few questions that I've collected from the chat, many of which are to the panelists. So I encourage everyone who can, I know Marina can't, but to come on back onto their camera. So Jessica, Amber, and Lindsay. I'm kind of starting with a general question, and I guess let's start with you, Amber. Have you experienced resistance or concerns from staff facing this shift, and have you addressed those concerns?
Well, I think that is an ongoing battle, right? So as we are anticipating this new process to come out for our staff, what we're currently doing is aligning our field resources to accept this change. So I'm in a meeting for the last 2 days where we've been working with all of our foster care and adoption supervisors we broke the news to them that this means restructuring field units and looking at regions specializing with units that only do traditional kinship or traditional assessments, units that will only do kinship. Some regions will have to have flex units to do a little bit of both, and then the other little mixtures of work that we do. We're also working with we know what some of our barriers are with our current approval process, one of which being access to fingerprinting facilities and being able to get those results. And so we've heard that from our staff for a while under our current practices. And so we're looking to expand our contracts to get the mobile units and train some of our resource staff, hopefully, to be able to have a couple of those machines per region so that our staff can carry those out with them. And so we're right now kind of resituating folks to accept the change. And so it's an ongoing conversation. And like I said, I think the danger with that is they know change is coming. We've got to get the change to them. And we can't lose the excitement for the people that are excited and the people that are going to be disgruntled by it. We need to go ahead and get it here and see what really happens, I guess. But we're really working hard to try to specialize or to try to figure out what staff enjoy doing, what they're good at, and give folks a voice in what they want to do in this future vision of what our field structure is going to look like.
Well, it sounds like you're making it easier for them too by doing all these, giving them these tools. Do you have any strategies, Lindsay, to add to that you're employing?
I mean, I think just ongoing conversation. I mean, I think the messaging piece has been really important about this, but also letting people know, like, we want to hear what's happening out there, right? So, like, if you have questions or issues or concerns, like, we definitely want to talk about it and keep talking about it. So I think that, and also just even the way that we presented the information, because we partially did this because we implemented it so quickly in order to get our policy revised to turn in our plan. That we said, hey, we know that we didn't slow walk this, that we did this really quickly. So we expect that we're going to find some areas where we may need to provide some additional direction or some suggestions that people might have that might make the process better. And so we expect to track and adjust. And we've had a lot less negative comments or negative feelings, I think, about that, because people do feel like there's an opportunity to have input. And as the process goes, which really honestly, all of our policies have opportunity for input. But just saying that out loud, I think, makes it a little bit more digestible. And also hearing people's concerns, I think that was a big piece of the people that I knew had some really serious, like some real strong feelings about it. I called and just had a conversation. Let's talk about this, especially leadership, and that was feeling that way in different areas. It's like, hey, let's talk about what this really looks like. And you know, families that have raised their grandchildren or their niece, nephew, whoever it is, friend, without any training. So if it was you, how do you think you would feel? And it doesn't mean that we can't. If we find a safety issue, it doesn't mean that we can't ask to a family to help remedy that or provide some kind of intervention to remedy that, just like we would for a regular foster family. So I think just continuing to have the dialogue has been helpful in implementing, and also just inviting them to be part of the conversation, I think, has been really helpful to just kind of ease people's minds, and then also allow them an opportunity to be part of the change.
Thank you, Lindsay. Jessica, you touched on this during your, answering Marina's questions, but we got quite a few comments in the chat about, families want to know what this means for them. How can a kinship family get licensed so they can get guardianship assistance in Michigan? Can you speak to that, the removal process, and that this isn't open to your average, the very many more kinship families that are outside child welfare?
Yes. So this new approval standard would only apply to families who have a child who is being removed from their parents by CPS and placed into the foster care system. So unfortunately, that does not include most of our kinship families in the state of Michigan. If Child Protective Services does an investigation and decides to petition the court for removal of a child into our foster care system, our state statute and requirements and policy have always been that kinship family would be looked for first. So that's what we do. We try to find a kinship provider who can take placement. And we have had a process in place for several years where we can make an emergency placement with a kinship provider. So that way children do not have to be placed in a traditional foster home where we're waiting to find that kinship provider. So if we're able to quickly identify a kinship provider, we are placing with them right away, as long as they can pass our safety screens, which we've tried to make just safety related and as easy as possible. I mean, outside of that, then we would continue on with the assessment process and doing the fingerprint checks to receive full approval for that placement, which typically would happen in the first 30 to 45 days. But definitely, Anna, I hear you, and I want to reiterate, this is only available to families who have children who were removed by CPS and placed into the foster care system.
Thank you, Jessica. Yeah, and we do feel like it's kind of kicked in the door too, I would say. If the foster care population is so well defined, we know exactly how many children are in foster care. So, the financial implications can be controlled. But once we're at least establishing and we're acknowledging the principle of equity, of financial parity within child welfare, then we can kick in the door for temporary assistance for needy families and increasing that support and making it more accessible and the like. But it can be frustrating to a lot of caregivers, but I see it as overall support for the family. So that's the plus. Jessica, I've got some weedy questions for you too. When you were piloting the payments, when you were making payments prior to licensure, let's see, I'm trying to read this, and you're not requiring licensure, did you notice any differences in your kinship disruption rate? So pre this, yeah.
I wouldn't say that we've noticed any significant differences in our kinship disruption rate, mostly because Michigan's really never done a really great job of licensing most of our kinship providers. So there isn't like a control group that we can really point to. However, I would say that since we started paying our kinship providers, we have noticed a significant increase in the percentage of children being placed with kin and maintaining placement with kinship families. We've gone from about 35% of our children being placed with kin to 50% or over some of the times of our whole child welfare population. So that I would say, as far as data goes, is really the best indicator that I could say of why it's so important to financially support our kinship providers equally from placement. It has made a huge difference in our kinship families' ability to actually take that placement, which is why I totally understand why those families who have placement of a child outside of our child welfare system also need that financial support. And I fully would love to see that implemented as well.
Yeah, and there are some good practices out there that we're going to be sharing more and more about at the Grandfamilies and Kinship Support Network. So thank you, Jessica. We got several questions for you, Jessica, probably because you've been approved, so people are excited. How much? So since the kinship is approval in Michigan, let's see. Does not approve the home or has to change to a non-approval for some reason, is there an appeal process for the family to appeal?
So, yeah, I think I'm guessing that this question came in when we were talking about getting those fingerprint results after we did our initial assessment for placement. If something were to come up that we hadn't initially found and had to reassess for. We have had an appeal process anytime a caregiver is not recommended for placement, a kinship caregiver is not recommended for placement in Michigan. It goes through our foster care review board. Kinship caregivers can request a hearing from the foster care review board, who can then make a recommendation about whether or not that placement makes sense or not with that kinship provider, based on the assessment that was done. Also, once the foster care review board makes their determination, it will go to the judge that's overseeing that child welfare case. So then they will ultimately make a decision whether or not they want to order the placement with the kinship provider, which does happen sometimes, especially if we're in a bit of a jam with maybe the way our policy is written, but we know it's the best placement for kin. That's always our safeguard is having the court order that placement with the kinship provider. So there is an appeal process in place, and that is able to be used. I did want to note, though, that just because criminal history might be found on a fingerprint background check that wasn't previously assessed doesn't mean that we necessarily say the kinship provider was unapproved. Usually we can safety plan around what we find or have a conversation with the kinship provider around what we find and make sure that it's not a safety risk moving forward.
Thank you, Jessica. And I think this question might be, we'll start with you, Marina. Now I've lost it. The payment question. So we're getting this from Maryland and wondering, workarounds that states have developed around payment. And I hope that's enough information for you.
Yeah, I think that question came in from Maryland around people that don't have immigration documentation. And so we have a few different techniques that we have heard. And it really, I would think that this boils down to working with the individual family and what they're comfortable with. We have heard of families and we've worked with them directly who have bank accounts and are comfortable getting direct deposit. There are families that need a prepaid debit card every month that's reloaded. There are some families that can accept checks. Our understanding is a few agencies don't know how to move past like the W-9 that is asking for a social security number. And so we are Maryland, if whoever, I'm sorry, I don't know who sent it in. Feel free to maybe send in a TA request and we can send you the details on how some other places have done that. It's definitely doable is what I want to emphasize, although it might involve changing some policy or practice that you have.
Thank you, Marina. I will throw this one to Amber and then Amber, you can punt it to someone, but can you give an example of a CPS placement under the new rule? And I guess it would be like what it would look like.
So like in Oklahoma, the way that our child welfare system works is if someone has a concern for a child or report's called into our hotline, if it meets the definition, it's a sign of abuse or neglect, it's assigned for investigation. And our CPS worker will go out, assess the family situation, interview the people in the household, and then they'll make a determination as to whether or not that child is safe or unsafe. If the child is unsafe, our practice is that we try to safety plan rather than to remove a child first, of course. We start with looking at whether or not there are options for an in-home safety plan followed by an out-of-home safety plan. Those are supposed to be time limited. When that's not possible, that's when we work with our district attorneys here and our judges to ask for emergency pickup orders. So when a child's actually placed into our custody, our resource staff are engaged. Say if we get a name for kinship provider from the investigating worker, or say someone comes in and wants these children because they've just been removed, we can initiate our kinship process because we have an emergency kinship approval process that would allow us to do an assessment, place the children, and then the family would have to complete all of the additional requirements that we have now, which is the same as traditional. So in the new world, once we're operating under new kinship standards, we'll get that removal and we will currently, what we have to do is child welfare and Oklahoma background checks, as well as a walkthrough of the home and 3 references, then we can place. If they've not lived in Oklahoma in 5 years, we can use a purpose code X name-based NCIC check to check out-of-state criminal, but we run into the same roadblocks that everyone else does with getting our Adam Walsh Child Welfare Registry checks. So our field staff in foster care have actually made points of contacts with certain other states to get emergency child welfare checks. We've had really good luck with Oregon. So if there's anyone from Oregon on the call, I'm hearing that our staff are getting results of child abuse and neglect checks within the same day from Oregon. So I don't know how Oregon's doing that, but it's fantastic. And we were able to make a kinship placement just a few weeks ago from a family that had lived in Oregon within the last 5 years, same day. We got fingerprint results same day because our system just so happened to work out great. And Oregon responded just like that and gave us what we needed. So in the new world, we'll do those same checks. We'll go through our safety and needs assessment there and our caregiver suitability, and then we'll be done. Now, we do here in Oklahoma issue an initial startup stipend to our kinship families currently, which is equivalent to a 1 month payment at our foster care rate. And so luckily, moving to model kinship standards, we have a little bit of leeway because that gives us 30 days to get those fingerprint results in, because they're already going to get an initial kinship startup stipend for each of the children placed in their home, that will cover that first 30 days. So we're hoping during that first 30 days, we'll be able to get our fingerprint results, and maybe by then we'll have the registry check figured out, right, Marina?
And
Hopefully, yes.
Amber, how long is your safety agreements? How long do they last?
I believe our in-home or out-of-home safety plans are not supposed to last more than 90 days. Now, there are situations where those go beyond 90 days, but those often end up flowing into situations where the kids end up coming into custody, and then we as an agency need to work to go try and make it right with the family because they've been caring for these kids for 3 or 4 months prior. And so it really sets us behind the ball of getting the kinship family set up in the right way, because they began under a CPS out-of-home plan and then transition to, oh, this is actually going to result in a removal.
Yeah, some frustration with the extensions are being expressed in the chat as well. In terms of seeing the caregiver suitability assessment, is a draft going to be shared, Marina? Or when can they expect to see that?
That was going to be how I closed out today. It was going to be how
Oh,
you can
okay.
sign up to see it and give us feedback. So
All right.
give us 2 minutes and I'll share that, Teresa.
Okay, sounds great. Well, in terms of closing out, I'm also going to give you another prompt then, Marina, and because we're getting close. So in terms of training, want to know what kind of pre-service training is going to be required, or in-service training. So that and the other thing can transition you into your closure. And I thank you all so much. And for any questions that we didn't get to, if you'd fill out the TA form, we will get it to Marina, or we will get it to someone else who can answer it, because we have a whole host of experts here at the network. So I will have one of the team members drop the TA form. And thank you, Jessica and Lindsay and Amber, so much. And I will transition it back to you, Marina.
Thank you so much. Yes, thank you again to our panelists. You did an amazing job. That was really, really inspiring and also really detailed. Okay, in terms of what is next, so the last missing template of the caregiver of the model standards has been the so-called caregiver suitability template. Ro, if you could bump to the next slide. Thank you. We have finished. So what we've done so far is we have collected all the forms for every state and tribe and territory in the country and tried to pull out the best of each one. We've also interviewed a number of kinship caregivers and a number of workers. Many of you in the audience, I know we're part of that user research round. And then of course, this is also building on all the research we've done over the last year as well. So we are in the last phase of this, which is we have a draft template and we really want feedback on it. So we are interested in feedback from, we are particularly need your help looking for a few groups of kinship caregivers who we don't feel are well represented yet. And we really want to make sure that they are represented. And so if anybody in this audience has a thought on ways that we could find them, that would be immensely appreciated. So we are looking especially to reach kinship caregivers who identify as LGBTQ2SIA+. We are especially looking, as come up many times today, in talking with kinship caregivers who are immigrants, especially those who are not documented or who have a mixed status family, because we want to make sure that they feel comfortable with the forms that we have now. And if not, we want to find ways to fix the forms and fix the process. And we are also looking to interview some monolingual Spanish speakers, so people who only speak Spanish. If you have ideas of how we can reach these folks, we will pay them a $100 Visa gift card for their time, and we will do a 1-hour paid research session with them. So that's what we would love your help finding them. I'm going to drop an email here in the chat this is my team at Bloom who conducts all the user research. They're a really amazing trauma-informed user research team. And if you have thoughts on how to reach those groups, we would really appreciate it to make sure that we are as representative as possible. You can also reach out to them if you would like to give feedback on the draft form as it is, and then we will be sharing it out. I believe I see Anissa in the audience. Correct me if I'm wrong. I believe in June we will have the template hopefully tested and tire kicked and ready to go. So, and it is based off of the assessments again of many that they're out there right now with some improvements. So you shouldn't see it and think, oh my God, this is left field. It should feel pretty natural to you. Next slide, a couple other things that are next. So we are going to learn from Michigan and Nebraska and other places that historically have not necessarily licensed all of their kin in terms of, sorry, that was very confusing lead in. Let me rephrase that. In terms of what judges are looking for in guardianship and adoption paperwork, some agencies are used to giving their judges, like literally a foot of printed paper from having an extensive licensure process up to that point. And then other agencies don't do that at all. And so we want to really dive in on that and make sure that there are no hiccups that once a kin specific approved or licensed family moves to guardianship or adoption in a state that maybe historically was expecting a different set of information. We want to make sure that they have everything and they're comfortable with it. So we're going to do a bunch of user research with permanency workers and judges around that, which we are excited to do. And then also, while the model standards do not recommend any pre-service training for kin, because that will delay licensure and approval, and placement has already been made. And I think Lindsay just made a really great point a few minutes ago that, like plenty of people have been raising children for a long time without 27 hours of our pre-service training. We still very strongly believe that training should be available and accessible to kinship caregivers after their license are approved as they may need it. It might be that there's particular behaviors that they are struggling with. A topic we've heard a lot from kinship caregivers is on navigating their family boundaries in the context of foster care. And so we are going to do some user research with trainers and also with kinship caregivers to understand more about, hey, what training do you really find valuable? And also, how is it most accessible? Is it on weekends? Is it on Zoom? Is it having childcare available with transportation? Whatever things that they surface to us, and we will share that back out. So we are excited to see what we learn there. And with 2 minutes left, that is it for me. Thank you all so much for coming. Thank you to the panelists. We are just thrilled to watch the progress of kin-specific adoption, kin-specific licensure and approval around the country. And Anna, I'll pass it back to you to close out. Thanks.
Thank you, Marina and Amber and Lindsay and Jessica. So appreciate you all joining us today. In the chat, we're going to drop a survey. If you wouldn't mind taking a minute or two to answer that survey, that helps us develop webinars and offer webinars that are useful to you. And also for any technical assistance requests from either Marina or anyone, and you don't have to call out the person in the form, or you can call out the person in the form, please complete that form. That helps us to track it and to manage all the requests that we get. And of course, please follow us on LinkedIn, use our resources on the website, of which we have many, and please stay connected. And thank you all for joining us today. Really appreciate it.